TV's W5. A helpless father mistreated by a trusted caregiver.
Just rubbing my dad's thigh, and I said, "What are you doing?"
A dedicated healthcare worker attacked by a troubled patient.
The constable said that there had been an accident.
Could these tragedies have been prevented?
The most disgusting thing I've ever seen in my life.
Sandie Rinaldo investigates claims of abuse in Canada's home care system.
Why did you do it?
Struggling workers and families at risk.
Who has been assaulted by a client?
And when the government seems unable to help,
How many people have to die before the government takes it seriously?
both sides are in danger. And
Action! You know, we're making a comedy, so if we're not laughing...
bringing small-town wisdom to the masses.
I'd say that this is the most valuable work experience of my life.
And breathing new life
Alpha Mark?
into Canadian comedy.
There's the toughest guy in here.
Jared Kiso
That'd be me.
details his journey from the lumberyard to Hollywood.
They do chew you up and spit you out.
Kevin Newman reports on the phenomenon that is Letterkenny.
This show's all rhythm.
But it's the creator's sense of hometown pride
Love to see those laughs.
What f***ing satanic clown orgy did you just crawl out of?
that keeps him humble and grounded.
And I'll never be that nutsack, I promise you that.
Here is Kevin Newman.
Hello, and thanks for joining us. On this edition of W5, Sandie Rinaldo continues to open our eyes to the potential for abuse in the care of our elderly, moving beyond the walls of institutions this time into the homes of Canadians who have hired personal support workers who are often alone when they provide their care. Now, governments have been encouraging seniors to stay in their homes longer with PSWs to help out. It can save money and it can help ease burdens. But as Sandie reveals in 2 cases tonight, the potential for abuse may be even greater when there's no one else around to watch what's going on.
Every time Frances Economou comes to this cemetery in Scarborough, just east of Toronto, where her father is buried, she is reminded of what happened to him and how powerless she was to prevent it.
Terrible things I couldn't believe.
When George Economou was 67, he was diagnosed with a brain hemorrhage. Soon after, he was left mentally impaired and unable to care for himself.
He didn't know how to eat. He didn't know how to go to the bathroom.
It's hard.
It was very hard.
And it was on your shoulders,
It was,
so...
because I stayed home to do that, to take care of him.
Frances didn't want to put him into a long-term care facility. She wanted to look after her proud father herself. A hard-working immigrant from Greece, George had been fiercely protective of his family, and he instilled that sense of responsibility in his only daughter. You made the decision to keep him at home.
I was going to do what I could to keep him at home and to keep him happy.
But she couldn't do it alone. She needed help. How did you go about the process of finding someone to come into the house?
The hospital, I believe it was, they told me that we can get the PSW to come in and help, like giving him a bath. I didn't feel that I was the right person to give my father a bath.
Frances had joined the ranks of those keeping their aging and ailing parents at home. A national report on home care states that 1 out of every 6 seniors aged 65 plus receive publicly funded home care services. Funded by the federal government and run by the provinces, a commitment of $6 billion over 10 years. In principle, a good idea. A safe place, Frances believed. How wrong she was. Do you remember the first time you saw Danilo Alcala?
I do. And he was a nice man, he seemed like at the time, very bubbly.
Danilo Alcala, the personal support worker, hired through a government-funded agency to care for George in his home. What did he do for your father?
Would take him to the bathroom, help him into the tub, give him his bath, shave, comb his hair, and bring him back out to the living room.
And at that point, you had no reason for concern? There was no red flags or anything?
No.
Everything seemed to be going well. George was being cared for in the comfort of his home until one day.
I was in the apartment, and I don't think he knew that I was there. I just came around the corner and saw my father sitting on the couch, and Mr. Akalia sitting right next to him with his hand on his thigh and just rubbing my dad's thigh. And I said, "What are you doing?" And he just flat out told me, and it was very natural. And he said, "Oh, for these older people with this disease, you have to show them affection." I believed it. He sounded so good. That same day, my father told me, he said, "I don't want him to come back in here."
So your father, even though he was in the throes of a form of dementia, knew enough to say to you, "I don't want this man in my house anymore."
Right, but he didn't tell me what happened.
Frances was left worrying about what went on when she was not around, so she made the decision to move her father into a long-term care facility. And that is where she overheard a conversation about an assault at the hands of a PSW in a home. So Frances looked it up online and saw this press release from Toronto Police with a photo of Danilo Alcala.
And the man's face on my phone I went white. All the blood rushed away from my body. I said, "Dad," I said, do you know this picture? Do you know this man?"
You showed him a picture?
I showed him my phone.
Right.
So I showed him the picture, and he nodded his head, "Yes, I remember." So I said, "Did he do anything to you? And you didn't want him back in the home?" And he just nodded, "Yes." "Did he touch you?" He turned away, and he was just nodding yes, and made the gesture that he was inappropriately touched down there. I couldn't believe it, and I asked my brother to make the phone call to the police.
Roger Caracciolo of the Toronto Police Service was already investigating Danilo Alcala for sexually assaulting another senior, a 95-year-old war veteran. The son of the 95-year-old told police he was watching his father being sexually assaulted live on a nanny cam. We can't name the senior because of a court-imposed publication ban.
You have a 95-year-old who is just enjoying life, sitting, by a bay window, watching outside like always. And you have a predator.
It's upsetting to you even today, huh?
It's hard to watch somebody that says, "I'm here to care for you," force someone to give them fellatio, not knowing they're on camera. So it's as real as it gets. And in all my years, it's 18 years now, I don't think I was ever prepared enough to see that, and it's the most disgusting thing I've ever seen in my life.
The nanny cam video evidence was definitive, and in July 2015, Danilo Alcala was arrested and charged with 3 counts of sexual assault and 3 counts of sexual exploitation of a person with a disability. And other families came forward.
So it wasn't just this one case. There were 2 others, so there were 3.
There was a few. 2 that we wanted to proceed on and move forward with because the evidence was so strong.
Including George Economou's case. Detective Caracciolo took his statement, which haunts him even today.
So he tells us that the support worker would masturbate him when he was in the bath. And he's not strong enough to stop it. He's telling him, "No, stop," but he's not strong enough. George gave the interview, and that's the last time he stopped talking. He didn't talk anymore after that and died shortly thereafter.
A year after his arrest, Danilo Alcala pleaded guilty to 1 count of sexual assault and 1 count of sexual exploitation of a person with a disability. The Crown only wanted to pursue the case of the 95-year-old war veteran because of the strength of the video evidence, even though there were other victims like George Economou who came forward.
I can't tell you the amount of calls I got, and I would say minimum I received minimum 20 calls. And people were like, "Is this true? Are you sure?" Umpteen amount of calls to go through. He was a care worker for 10 years.
At sentencing, the judge painted a picture of a serial predator and said she has concern about his tendency to yield to such urges in the future. Danilo Alcala received a sentence of 23 months in jail and was released after 17 months.
Have you ever investigated anything like this ever before?
Never. Absolutely, unequivocally, the worst investigation I ever had to do in my life.
W5 tried to find out just how many seniors are assaulted in their homes by caregivers. Now, Ontario's Long-Term Care Act requires all facilities and institutions to report incidents to police in the province. But at home, it's up to families to take action, and not all do. It's also up to agencies to do background checks on the caregivers they're sending to look after innocent seniors, but it doesn't always happen. As for Danilo Alcala, W5 asked him for an interview. When he didn't respond, we found him living here in this Scarborough, Ontario neighborhood.
Danilo Alcala, I'm Sandie Rinaldo with CTV's W5.
I'm sorry, ma'am, I'm busy.
I'd like to ask you what you would say to the families of those, the seniors you sexually assaulted.
I pray their peace and rest in peace already, ma'am.
But why did you do it? I mean, people are wondering why you would have sexually assaulted innocent elderly men. Sir, you have an opportunity to speak to the family. What would you say to the family?
After just 2 years of probation, Danilo Alcala will be able to work in home care again. Frances Economou has this message for her father's former caregiver.
Shame on you. He's a frail man. This is a married man. Why? I don't understand. I'm so lost with this.
So bottom line is, unless they have a criminal record, you have no idea who's walking into your home to look after someone you love.
Correct.
Now that's scary.
Yeah.
Violent histories kept from home care workers
This is what we're not finding out.
can lead to a tragic end.
Women were his victim of choice.
When W5 continues.
Welcome back. Well, we've shown you how little there is to prevent the abuse of seniors receiving home care. Well, now Sandie Rinaldo is going to turn the W5 lens in the opposite direction to reveal how little there is to protect workers from abusive patients.
Walking through the University of Alberta campus in Camrose, Craig Wolski can't seem to shake the bitterness he feels every time he thinks about what happened to his wife Valerie, a dedicated healthcare worker.
It's not an easy job, but there were never any concerns for her own safety that she ever raised.
Craig and Valerie met and were married right here at the university. And now when Craig visits, he remembers how happy they were on their wedding day.
I'm sure it must bring back memories if we're standing in the chapel.
Yeah, I can remember standing right here and watching her come in and getting married, and I remember that night my face hurt because I was grinning nonstop.
Valerie had a difficult childhood. Raised in Calgary by a single mother, she helped care for her siblings.
And she wanted to always be able to give back, to help people to not have such a hard time with their lives.
Now Craig deals with the pain of losing his university sweetheart at the hands of one of the clients she was caring for, Terrence Saddleback.
So when Val was assigned to look after Terrence, did she express any concerns to you at the time?
Terrence is a large man. So in terms of concerns, well, obviously I would assume that any female coming into a situation with a large imposing man would send up a flag. And then at the reassurance of her employer, she determined that this was where she was going to work.
It was here in this house that the diminutive 4'11" Valerie Wolski was assigned by the Canadian Mental Health Association in Camrose to look after Terrence Saddleback, a 25-year-old, 6'5" man with a severe developmental disability. Saddleback was relocated from this provincially run mental health hospital on an initiative by the Alberta government to move patients into the community.
She would administer medications. She would take him out into the community on outings. Supported independent living is basically what the program is.
What didn't follow Saddleback to Camrose was his medical file depicting his long history of violence, particularly towards women and caregivers.
And she was always alone with Terrence.
Well, for the overnight shift, yes.
When did you first learn that something had gone dreadfully wrong?
About 10:30 the next morning. The RCMP came to my door, knocked on my door. The constable said that there had been an accident, and I said, okay, well, I thought he meant traffic accident, and he said, no, your wife's been murdered.
What did they tell you had happened to her exactly?
Sometime in the evening, approximately about 5 o'clock, Terrence strangled her. She was laying on the floor in front of the couch. Her phone was on the kitchen counter less than 5 feet away.
Craig Wolski believes his wife's brutal murder could have been prevented if only she had known about Terrence's violent history. Information her employer, CMHA of Camrose, claims to have never received from the province.
It turns out that the information that would have detailed him to be an aggressive person and that women were his victim of choice, that information was not provided to Canadian Mental Health Services.
But Valerie and the CMHA did hear rumors about Terrence. There was also a risk assessment report in Saddleback's file, prepared after he attacked another female staff member a few years earlier. It stated that if a violent incident should occur, the consequences could be extensive and irreversible, including death or permanent disability to the staff or support workers involved. The agency claims it wasn't aware of the report.
Didn't someone raise a red flag with Valerie? Didn't someone pass along information that gave her pause for concern?
There was people that said, hey, but at the time, it was determined that that information was not formalized. And because it wasn't formal coming, it was construed as rumor and conjecture.
Hearsay.
That could not be proven.
Rumors that turned out to be true, yet the agency, CMHA of Camrose, that hired Valerie never followed through with a full and detailed investigation.
W5 wanted to speak with Colleen Swanson, the executive director of the Canadian Mental Health Association, the company that employed Valerie Wolski. We wanted to know whether there was anything more they could have done to prevent the death of Wolski at the hands of Terrence Saddleback. And we wanted to know whether the agency was aware of the full extent of his history of violence. Well, Colleen Swanson turned down our request for a face-to-face interview.
Instead, she sent us this written statement. The level of risk disclosure to us was wholly inadequate. We would never have agreed to take on his care had we been made aware of the extent of Terrence's very troubled and violent history. W5 wanted to know how often healthcare workers like Valerie Wolski find themselves in danger. In one of the only studies ever conducted with a focus on community-based care in Ontario, McMaster University discovered that 20% experienced a form of physical or sexual violence in the workplace within a 12-month period. A staggering number. So W5 assembled a group of home care workers in Toronto to discuss the risks they face every day.
Who has been physically, verbally, or sexually assaulted by a client in their home? Show of hands. Okay. Can we talk about that?
Sure.
What's your name?
April.
April. April, what happened to you?
I was hired by a gentleman that needed help for his wife. And I would probably say within maybe a week or two of after his wife passed away, he had me cornered in his office in his basement. He tried to kiss me while he crammed his tongue down my throat. He grabbed my breast, not once, but a few times. He also grabbed my crotch and he grabbed my bottom.
Did you report to police?
No.
Nothing, you just let it go?
I just let it go.
Because you raised your hand when I asked if you'd ever been sexually assaulted while you were looking after someone in their home, and you said yes. What happened?
So the individual was palliative. So I leaned over to adjust his blankets to make him more comfortable. He grabbed both my chest, and he goes, I said, no, I'm sorry, this is inappropriate, and I pushed his hands away. And he goes, hey, I'm dying, I can do anything I want. So he has now passed, so we did not pursue it. I don't want to put his family through that.
So physical, verbal, possibly sexual abuse is part of the job. It's part of your job.
And more. You know what I mean? Bad people still need care. They still need a shower. They still need socialization.
Dedication despite an imperfect working environment that's underfunded, understaffed, and largely unregulated. There is a fix, these support workers say. It's just up to the government to do it.
Right now, it's a mess.
What has to change in order to make it safer in this business?
I would say communication, not just from the top. It would go from the bottom up, from the PSW to a coworker to the supervisor, and on the way up.
What I feel is the agencies should be advising whoever is going in to care for that individual if they have a history. This is what we're not finding out.
Crucial information Valerie Wolski never received about the violent nature of her client, Terrence Saddleback. Information that Craig Wolski believes could have saved her life.
I blame the key workers in the government office. They knew that there was all this information.
W5 spoke with the Alberta Minister of Community and Social Services, Irfan Sabir.
So what do you say to Craig about the fact that he blames the Alberta government for his wife's death?
It's a very heartbreaking incident, and I would agree that workers were kept in dark.
And why didn't she have all the information?
Because that time, in 2011, there was no laws in place which will ensure the flow of information.
But how many people have to die before the government takes it seriously?
We take workers' safety very seriously, and no Albertan, no worker should go to work in unsafe conditions, and every worker should be able to return home safely.
To that end, Alberta passed Bill 30 in December 2017. It ensures that employers share information and documentation with employees. Other provinces like Ontario, Manitoba, and British Columbia have similar regulations in place. Good for current healthcare providers, but too late for Valerie Wolski.
Have you been able to move past all of this, or does Val's death still haunt you?
There's still a great feeling of something's not finished.
And you miss her?
Oh, greatly. I probably will never ever find anybody like her ever again.
So how can you protect your loved ones and make sure they're safe in their homes? Well, police suggest maybe installing remote cameras and showing up unexpectedly. And always ask the agency for references. Here's what's straight ahead.
A career built on drama takes a turn for the absurd.
Your little cousin put a stink bomb inside a Nerf gun and fired it at his bus driver.
When W5 continues,